What if I told you thousands of people on ODSP aren't one paycheck away from success? They're one rent increase away from homelessness? This isn't about bad decisions. It isn't about laziness. It's math that doesn't add up. And people are paying the price with their housing, their health, and their stability. Today, we're talking about the hidden housing crisis facing ODSP recipients. The part nobody explains clearly, the risks nobody warns you about, and the survival strategies people are forced to use just to stay indoors. If you're on ODSP, know someone who is, or want the truth about how the system really works, this video matters. Hit like so this reaches more people who need it. Subscribe for real talk, real strategies, and no sugarcoating. And ring the bell so you don't miss the next breakdown. Because stability shouldn't be luck, it should be policy. 1. The housing reality gap. Homelessness among ODSP recipients isn't an accident. It's a structural gap between income and rent. The shelter portion of ODSP was never designed for today's housing market. In many Ontario cities, average rent has doubled over the past decade, while ODSP increases have been incremental. The result is a permanent shortfall. Recipients are forced to compete in a private rental market that prices them out before they even start searching. This creates what advocates call the housing reality gap, the distance between what ODSP provides and what a landlord actually charges. Many recipients spend 70–90% of their income on rent alone, leaving almost nothing for food, transit, medication, or emergencies. One unexpected expense, a broken appliance, a missed bus pass, a delayed payment, can trigger eviction risk. Housing instability doesn't always look like sleeping outside. It often looks like couch surfing, overcrowded apartments, unsafe living conditions, or constant threat of displacement. These invisible forms of homelessness are common among ODSP recipients. Stability requires predictability. When housing consumes nearly the entire benefit, predictability disappears. Survival becomes a monthly gamble instead of a foundation for recovery or growth. 2. The shelter allowance problem. The ODSP shelter allowance is one of the most criticized parts of the program. It assumes housing costs that no longer exist in the real world. Even in smaller towns, rent frequently exceeds the maximum shelter portion by hundreds of dollars. Recipients must pull from their basic needs portion just to stay housed, effectively robbing their food budget to pay landlords. This isn't poor budgeting, it's mathematical impossibility. The system forces trade-offs between shelter and survival. When rent rises, ODSP doesn't automatically catch up in a way that reflects market realities. Indexing helps slightly, but it doesn't erase years of lag. Many recipients are locked into substandard housing because it's the only option that fits the benefit structure. The shelter allowance also fails to account for accessibility needs. Units that are wheelchair accessible or medically appropriate often cost more, shrinking options even further. This means disability-specific housing needs collide directly with affordability limits. Without targeted housing policy, recipients face a cruel paradox. The housing that supports their health is the housing they cannot afford. The shelter allowance isn't just a number, it's a ceiling that determines whether stability is possible or constantly slipping out of reach. 3. Hidden homelessness. Homelessness among ODSP recipients is often invisible. Many don't appear in street counts because they're temporarily staying with friends, relatives, or strangers. This is called hidden homelessness. It's unstable, stressful, and frequently exploitative. Recipients may tolerate unsafe environments to avoid shelters or sleeping outside. Hidden homelessness erodes mental and physical health. Privacy disappears. Medical routines become difficult. Storage for assistive devices, medication, or mobility equipment may not exist. A person might technically have a roof, but not security. They're living in borrowed time and borrowed space. This instability traps people in crisis mode. It's nearly impossible to attend appointments, manage paperwork, or seek employment training when housing changes every few weeks. The stress itself becomes disabling. Hidden homelessness also exposes recipients to higher risks of abuse, financial exploitation, and coercion. Because it's not visible in the same way as street homelessness, it receives less attention. Yet it may affect more ODSP recipients than people realize. Stability is not just about shelter, it's about autonomy and safety. Without a stable address, everything else in life becomes fragile and temporary. 4. Eviction as a constant threat. For many ODSP recipients, eviction isn't a rare event, it's a recurring fear. Rent consumes such a large share of income that any disruption can cascade into crisis. A delay in benefits, unexpected medical costs, or rising utilities can push a household over the edge. Eviction is not just a housing issue, it's a health issue. The stress of possible displacement worsens anxiety, depression, and chronic illness. Recipients often prioritize rent above food or medication to avoid losing housing. This survival calculation sacrifices long-term health for short-term shelter. Once evicted, re-entry into the housing market becomes even harder. Landlords may hesitate to rent to someone with a prior eviction or limited income. Shelters are overwhelmed and transitional housing is scarce. The system punishes instability by making recovery harder. The fear of eviction also limits personal choices. Recipients may avoid reporting unsafe conditions or abusive landlords because they fear retaliation. Housing insecurity silences people. Stability should provide safety, not constant negotiation with disaster. For many, ODSP housing is a tightrope walk without a safety net. 5. Accessibility and housing mismatch. Housing for ODSP recipients isn't just about affordability, it's about accessibility. Many available units are physically incompatible with mobility aids, sensory needs, or medical equipment. Accessible housing is limited, competitive, and often more expensive. This mismatch forces recipients into unsuitable environments that worsen their disabilities. Stairs, narrow doorways, or lack of elevators become daily barriers. Some individuals remain housebound because their housing design prevents safe exit. Others experience increased injury risk inside their own homes. Waiting lists for accessible social housing can stretch years. During that time, recipients must improvise solutions that strain their health. Accessibility isn't a luxury, it's foundational to independence. Without it, housing becomes another source of limitation. Policy discussions often treat housing as a general problem, but disability adds layers of complexity. Stability requires units designed with real needs in mind. Otherwise, recipients are housed but not supported. True housing security means a space where a person can function, move, and live with dignity. 6. Rural versus urban housing crisis, ODSP. Housing instability looks different in rural and urban areas, but both carry risks. In cities, rent prices skyrocket, competition is fierce, and affordable units vanish quickly. In rural areas, rent may be cheaper, but supply is extremely limited. There may be no accessible units at all. Urban recipients face overcrowded shelters and long social housing lists. Rural recipients face isolation, transportation barriers, and limited services. If housing fails in a rural town, relocation may mean losing medical care or support networks entirely. The geographic divide creates unequal survival strategies. Some move frequently chasing affordability. Others remain trapped in unsafe housing because alternatives don't exist. Stability requires not just a unit, but access to services, transit, and healthcare. Housing policy often overlooks these regional differences. A one-size approach cannot solve a province-wide crisis. ODSP recipients experience housing through the lens of local realities, and solutions must reflect that complexity. 8. Social housing waitlists. Social housing is often presented as the safety net solution, but waitlists tell another story. In many Ontario regions, wait times stretch 5-10 years. Some applicants never receive placement before their situation changes or worsens. During that wait, recipients must survive in the private market. The delay effectively forces them into instability while they wait for support designed to prevent it. Social housing is not failing because it doesn't exist, it's failing because supply cannot meet demand. Priority lists help some high-risk individuals, but many remain in limbo. The emotional toll of waiting is immense. It's hard to plan a future when housing depends on an unpredictable timeline. A safety net that takes a decade to activate isn't prevention, it's delayed rescue. Recipients need immediate stabilization options, not just long-term promises. 8. Social housing waitlists. Social housing is often presented as the safety net solution, but waitlists tell another story. In many Ontario regions, wait times stretch 5-10 years. Some applicants never receive placement before their situation changes or worsens. During that wait, recipients must survive in the private market. The delay effectively forces them into instability while they wait for support designed to prevent it. Social housing is not failing because it doesn't exist. It's failing because supply cannot meet demand. Priority lists help some high-risk individuals, but many remain in limbo. The emotional toll of waiting is immense. It's hard to plan a future when housing depends on an unpredictable timeline. A safety net that takes a decade to activate isn't prevention, it's delayed rescue. Recipients need immediate stabilization options, not just long-term promises. 9. Exploitation and unsafe housing. When affordable housing is scarce, exploitation fills the gap. ODSP recipients are disproportionately targeted by landlords offering illegal units, unsafe buildings, or predatory rental agreements. Some accept these conditions because alternatives don't exist. Mold, pests, fire hazards, and overcrowding become normalized survival trade-offs. Reporting unsafe housing risks eviction, so many stay silent. This environment breeds power imbalance. Tenants fear retaliation. Landlords know recipients have limited options. Housing insecurity becomes leverage. Unsafe housing doesn't just degrade living standards, it damages health. Respiratory illness, injury, and stress multiply. The hidden cost of cheap housing is long-term harm. Stability requires enforcement, tenant protections, and real alternatives. Without them, recipients remain vulnerable to systems that profit from desperation. 10. Housing stability as the foundation. Everything circles back to one truth. Housing stability is the foundation for recovery, independence, and dignity. Without stable shelter, no program, medical, employment, or social, can function effectively. ODSP recipients are not failing housing systems. Housing systems are failing them. Stability allows planning. It allows health management. It allows participation in society. When shelter becomes secure, people can think beyond survival. The conversation must shift from emergency response to structural prevention. Stable housing is cheaper than repeated crisis intervention. It reduces hospital visits, shelter use, and social strain. Housing is not a side issue within disability support. It is central. A benefit program that doesn't guarantee stable shelter leaves recipients balancing on the edge of homelessness. Security is not excess. It is the minimum condition required for a life with dignity.